To enhance the provided script, I'll integrate an informative tone, align it with the purpose of patient education, and adapt the content for effective engagement with a general audience. Here's the revised version, formatted accordingly. Her anemia turned into blood cancer. Real patient stories. It wasn't just anemia. You won't believe what happened to Shannon. At just 23 years old, she had a busy life, balancing work at an accounting office and taking care of her 2 young children. But something felt off, unrelenting exhaustion that rest couldn't cure. She knew it was something more serious. Seeking answers, Shannon visited a nearby health center where a newly qualified doctor diagnosed her with anemia. He prescribed ferrous sulfate and sent her home, skipping even a routine blood test. Seems ordinary, right? But this was just the beginning of her journey. Despite taking the prescribed medication, Shannon's symptoms worsened. She began experiencing frequent infections like sore throat, sinusitis, and thrush. Then, purple spots, petechia, appeared on her skin, signaling a much more critical issue. She sought further help, where a simple blood test revealed shocking facts. Her white blood cell count soared to 72,000, 10 times above normal, while her platelets dropped to a dangerously low 18,000. She wasn't just anemic, she had leukemia, a serious blood cancer. In this video, we'll explore leukemia and anemia, their causes, symptoms, and treatments. But more importantly, we'll dive into stories, lessons learned, and how early intervention can save lives. Anemia occurs when your body lacks enough healthy red blood cells to transport oxygen effectively. These cells are crucial for delivering oxygen from your lungs to your entire body, your heart, skin, brain, and even your big toes. A lack of red blood cells affects vital body functions. Feeling persistently tired, even after sleep, is often the first sign, followed by weakness, shortness of breath, and even hair loss. These are the body's cries for help, as its organs and tissues aren't receiving enough oxygen. The most frequent cause is iron deficiency anemia, often linked to heavy menstrual cycles, surgeries, or conditions like hemorrhoids or worms. Women are particularly prone, making doctor consultations crucial. Beyond iron deficiency, vitamin B12 and folic acid deficiencies can lead to megaloblastic anemia, where abnormally large red blood cells fail to function efficiently. Chronic diseases, like kidney failure or autoimmune conditions, can also result in anemia. Shannon's case, however, revealed an extraordinary cause for her anemia, leukemia. Let's delve deeper into leukemia. Leukemia is a cancer of the blood-forming cells in the bone marrow. It disrupts normal blood cell production, causing an overproduction of abnormal white blood cells. These cells struggle to fight infections and interfere with the production of healthy red blood cells and platelets. This imbalance explains Shannon's symptoms: anemia from a lack of red blood cells, frequent infections from defective white blood cells, and bleeding and petechiae from low platelet counts. The disease's progression and the type of blood cell affected define its classification. Acute leukemia is aggressive, with symptoms appearing suddenly. Without rapid treatment, it can cause severe complications like organ failure, infections, and uncontrollable bleeding. Chronic leukemia, while slower to develop, also disrupts blood function over time. Each main type, acute and chronic, has subtypes such as lymphocytic leukemia and myeloid leukemia, depending on the specific white blood cells involved. Shannon's diagnosis was acute leukemia, requiring swift intervention to save her life. Leukemia treatment depends on the type and the patient's overall health. Shannon was admitted to the hospital immediately for intensive care. The primary treatment, chemotherapy, targets and destroys leukemia cells. However, it can also damage healthy cells, leading to fatigue, nausea, and hair loss. In advanced cases, like Shannon's, a bone marrow transplant may be necessary. This involves replacing the diseased bone marrow with healthy stem cells from a donor. After a rigorous chemotherapy regimen destroys damaged marrow, the transplanted cells are introduced into the bloodstream like a blood transfusion. These cells establish themselves in the bone marrow, restoring normal cell production. Bone marrow transplants come with considerable risks, including graft versus host disease, where the immune system attacks transplanted cells, infections, as the immune system becomes weakened, transplant failure, where the new cells fail to settle in the marrow. Despite these challenges, transplants save lives. For Shannon, her transplant was a success. She made a full recovery. Shannon's recovery highlights an essential truth. Transplants rely on compatible donors. Unfortunately, finding a match isn't easy. Compatibility depends on HLA typing, a process that tests for protein markers in white blood cells. When no relatives are a match, patients turn to registries like the American Registry for Non-Related Donors. However, even with these registries, the number of registered donors isn't always enough. Bone marrow donation is simple, often as painless as giving blood. Registered donors may never be called upon, but when they are, they become a lifeline. Imagine saving someone's life in just 90 minutes. I've encountered families devastated by donor reluctance. One patient, a young person full of promise, missed their chance due to a withdrawn donor. Stories like this emphasize the importance of spreading awareness about the life-saving potential of bone marrow donation. Shannon's journey reminds us of the power of early diagnosis and the value of seeking second opinions. A simple blood test could have flagged her leukemia sooner. Additionally, it's a call to action for all of us. Recognize symptoms like unexplained fatigue, infections, or unusual bruising. Inspire more people to join bone marrow registries. If one donor's decision could save a soul, what's stopping us from registering today? This story is one of hope and resilience. Shannon's recovery underscores the strides modern medicine has made, but it's equally a story of community care. By raising awareness about leukemia, anemia, and the importance of donation, we can save lives together. Thank you for joining this vital conversation. My name is Carly Steph R. Benjamin, and I urge you to subscribe for more eye-opening content. Don't forget to share this video with loved ones. They, too, might one day save a life. This revised and expanded script ensures a balanced, informative, and engaging narrative to educate and inspire the general public about patient education and life-saving medical interventions.